All right, well, I think we can go ahead and get started. Good afternoon, everybody. Welcome to IPHA's third Thursday Lunch and Learn web series. My name is Brett Norris, and I'm IPHA's Communications Coordinator. Thank you for joining us today. We've got a great lineup of speakers for this whole year of Lunch and Learns, and today is no exception. We're glad you could make it. This session is being recorded, and it'll be posted to IPHA's YouTube channel later this month. Before we get started, just a couple housekeeping items real quick. Your microphone should be muted during the presentation so that we can hear everyone, and so that we have enough bandwidth to make sure there aren't internet troubles. You can put your questions in chat or the Q&A features of Zoom, and there will be plenty of time for live discussion where you can take yourself off mute, turn your camera on, and ask any questions you'd like that way. Today, we're joined by Julie Sather from Buena Vista Public Health, along with some community partners. We have Di Daniels and Stacey Cole, who are going to talk to us about the collaborative pandemic response. Sharon's going to help lead the discussion in Q&A as we go along, but for now, I'm just going to hand it over to Julie so she can get us started. Julie?
Hi, good afternoon, everybody. As Britt said, my name is Julie Sather, and I'm the administrator here at Buena Vista County Public Health and Home Care. Thank you so much for joining us today. When Sharon and I first talked about this, probably about a year ago, the pandemic was still pretty heated. But as we've really gotten, I would like to say, through the pandemic, I think we're still technically in it, but kind of through the pandemic, we've really kind of shifted the focus of this presentation about really lessons learned in the pandemic. When I started my job, it was 2 years ago yesterday. So, but lessons that we learned, I learned a ton. But really two main lessons that I learned was there was the way we did things before the pandemic. And there really is some of those things, there was a better way coming out of the pandemic, and we didn't have to do things the way that we always did them before. So there were some positives that we learned through the pandemic. And number two, and I think the most important thing that we learned is that there is power in partnerships. None of us are alone, and that it's okay to lean on others. So today I'm joined by two fantastic women that are a part of the stitching that holds our community together. Okay, so Buena Vista County. So just a little bit about us. So we are in the northwest corner of Iowa. 3 down and 3 from the left is how many of us were taught to find our county on the map when we were young. We were named in memory of the Battle of Buena Vista in the Mexican-American War, which I think is kind of cool when we look at what our county is now, and the large population of Hispanics that we have in our county. So kind of cool to look at the history of it. Storm Lake is our county seat, and is definitely the largest town in our county. We are considered a micropolitan area from a statistical purpose, which gives us a few different opportunities when it comes to various grants and so forth. So we have 10 different communities in our county, 5 school districts, one community college, which is Iowa Central, and 1 university, which is Buena Vista University. Pretty crazy. We're 91% farmland and 1% water. So part of what makes our county unique, both beautiful and challenging, is the differences that we see throughout the county. As you can see on this slide, the demographics that we see in the county outside of Storm Lake is significantly different than what we experience inside of Storm Lake. So what you're going to hear primarily from Di and Stacey is from a focus of within Storm Lake. But as us looking at it from a county health department, we have to look at within Storm Lake and all of these different demographics, but then also our very rural population outside of Storm Lake, and very different needs when we look look at our area outside of Storm Lake. So really throughout our county, 33% even outside of Storm Lake has a language other than English spoken inside the home. So diverse throughout the county. So a little bit about our agency. We are a certified Medicare home care agency. Not real big, but we do have an average daily census of about 64 patients. So we see people throughout the county for skilled home care, as well as chronic home care needs. You know, our goal is to keep people at home as long as we can. We only have 2 nursing homes in our county. So keeping people home as long as we can is definitely our goal. We do offer limited homemaker services. We subcontract for maternal health and WIC services through New Opportunities Incorporated in Carroll, and then child and adolescent health services with Pickham's Family Health Services in Denison. We also provide a home visitation program contracted through Early Childhood Iowa called Family Steps that focuses on parenting success. And as I said before, we've realized that the importance of partnerships is paramount. During the pandemic, we relied on our partners to help us in various ways. And now we have realized post-pandemic that those partnerships are more important than ever. We have become close partners with Buena Vista University, and we actually hired a marketing intern that assisted us in sharing important information in relevant ways to share information with various demographics. We've developed a relationship with the University of Iowa that is allowing us to grow the services that we can offer here in rural Iowa. Partnerships with our large ag leaders such as Tyson and Rembrandt Foods were imperative to gain the trust and to access the employees and the families that work in those environments. And as I mentioned, I have 2 of our biggest partners here with me today. Excuse me. Representing SALUD Multicultural Health Coalition is Di Daniels. Di's smile is infectious, and when she is really thinking, her words flow best in Spanish. Di is the co-director for SALUD. Di is the best person to explain the role of SALUD, but to sum it up, I always say it is not to only make sure everyone has a seat at the table, but also to make sure their voice is heard. My friend and partner, Di Daniels.
Thank you, Julie. I appreciate so much being a part of this conversation and so grateful to be part of a community that's strongly collaborative. And of course, the Storm Lake School District and BV Public Health have been just strong partners since the inception. So I'm going to share my websites, share my screen on my website to keep me on track here. So let's see what we got. How's that, Julie? Good. Okay, so a little bit of our history. The coalition is about 10 years old. And at one time, back in 2009, 10, 11, I was one of the, I served on the Iowa, well, yeah, I served on this Office of Minority and Multicultural Health. Obviously, I'm not flowing in English today, right? Maybe I should switch. No, the Office of Minority and Multicultural Health Advisory Committee, and under the executive directorship of Janice Edmund Wells. This woman, talk about an infectious smile, and a wonderful woman, is the first one that sort of nudged me and said, you know, if you're living in Storm Lake, and I had just moved here, she said, you should start a multicultural health coalition. And I was very dubious because having started one in Sioux County, I knew it took years to build relationships, to build trust and all that. And there's no way to fast forward. However, what I discovered rather quickly is that there were already people with boots on the ground doing the work that I also wanted to do. So it was a matter of just locating each other, and it just sort of like spontaneous combustion. So I'm going to go back here and go to our mission and vision. And I have to say that for 10 years, we operated without all the, I'm going to say trappings, because that's how I sort of perceived them, of a 501c3 or mission and vision and all that. But we did come to do this, and we are now a nonprofit, a registered nonprofit. And as is said, as Julie said so beautifully, we believe in collaboration rather than competition. And we try to serve our community by building community. And we envision a Storm Lake community that values diverse leadership as essential to achieving equitable opportunities for the health and well-being of all. And the way we do this is by holding spaces for authentic dialogue, a monthly coalition meeting. I'm happy to say that after being on Zoom for almost 2 years, we are started getting back in the groove of being face-to-face, and that's really lovely. We invite community members to co-create and shape responses to community needs. And this last one, I'm going to tweak a little bit, because I always sort of, that empowering word, I stumble over a bit. It implies that we have the power to give. And that's really not the right word. I need to change it. It's more like offering a platform for those leaders that are emerging, so that they can have a leadership role, or they have easier access to a leadership role. And that's pretty much what we're all about. I'd have to say that in the beginning, finding each other 10 years ago, it was very grassroots. When we identified that vision of doing nothing but what individually we were already doing, which was to make sure that our immigrant friends and neighbors, actually anybody in that sort of marginalized group, were being cared for physically, emotionally, spiritually, socially. And equity of treatment, culturally appropriate treatment, accessibility to healthcare, and advocacy for availability of healthcare information in different languages, those were just on the top of our list. But then COVID hits, of course, and things change. But the really good things that came out of COVID for us was being, it didn't seem good at the time, but being converted to Zoom. So envision a coalition that is more like a gathering of old friends over coffee. Those interactions were super important, not even before and after the meetings, probably more so before and after the meetings, when little groups would get together and you could just see the ideas popping. So going to Zoom was a little bit disappointing, although what it did do is it broadened our audience, and we started getting more partners from outside our county. So that was a good thing. And it also put a full stop, COVID put a full stop on our many activities, because we're sort of a boots on the ground kind of folks. And suddenly, if you don't have that, it's, whoa, what do we do? We were able to carry on with a couple of things. The keynote one being promoting COVID vaccines. But what it also did is gave us time to sort of slow down and look at who we were, the sustainability of having a coalition that was pretty unstructured. And a gentleman from ISU Extension, John Wolseth, was also an ISU Extension, a strong collaborative partner and mentor, I'll say, would gently say, to me, the old hippie who was anti-establishment, would say, you should think about those, sustainability, you should think about this. So suddenly I had time on my hands to listen to him. And he he helped us form that vision and mission. And I'll say the beauty of doing it that way is that he just took what we were already doing and he put it into words. And I also feel that way when we got our ID, becoming a 501c3, and then getting an IDPH grant that was focused on, the promotion of the vaccine information, COVID information, dispelling myths and all that. We were sort of ready for that because we were able just to roll over the existing programs we are already doing and add that element of promoting the vaccine and promoting good information. So I'm gonna just hit on a few things that Julie asked me to hit on that are don't seem to be exactly the focus of this conversation today, but they are. And so one of the things that we were doing, were interpreting workshops. And so this is important because we identify community interpreters. We know that they are bilingual, but not necessarily trained officially or certified interpreters. And that's perfectly okay. However, if we just invited them and said, okay, you're already interpreters, we're going to show you a path to becoming certified if you want, if you can, but it is an onerous process and an expensive one. So understanding that, we still thought we want to offer this because even though you may not want to be a certified interpreter, you can be the best you can be. And we are fortunate to have access to Professor Pete Kuna in Northwestern College, who is certified court and certified federal and state court and medical interpreter. And he's a teacher, an excellent teacher, and he just completely passionate about this. So he comes and we've had, I don't know how many, maybe 10, 12 over the years. And we have to limit it, and it's always a sellout. And we would have to raise money before, but once we got the IDPH grant, we were able to offer to these folks for free who are not necessarily earning a high income, right? And so we infuse the fact that, how to the COVID vocabulary and how to speak about those issues and how to, because it's a whole new set of vocabulary. So that was introduced. And just recently, and this is where Storm Lake Community School is a great partner again, we started to realize that if we hope to challenge people to become certified interpreters, we got to go younger. And so we're working with the high school students, those that are bilingual, those that are juniors and seniors, and only quarterly right now. But it's really wonderful because it's a chance for them to realize that what they've always probably been doing since they were 5 years old for their families, that's a possible career choice. And just like the community interpreters, if you're doing it, here's where you should be careful. Here's the right way to do it. To keep that in mind. And also as a minor, there are situations that it's okay for you to say, no, I shouldn't do that. So that's one thing that we continue to carry on, and we're very pleased to be doing that. Another thing that we do are cultural humility workshops. And I know you've probably heard of cultural competency. And I think I'm speaking to the choir here, but just in case somebody doesn't know, cultural competency is the hopeful acquisition of enough knowledge of another culture that you become somewhat proficient in understanding them and understanding their needs and their ways. But cultural humility makes even more sense to me because it admits, well, I'll read it to you. It's an approach that allows us to challenge our own personal biases, makes us aware we cannot possibly know everything about other cultures, beliefs, lifestyles, etc. And we are committed to the fact that learning about other cultures is lifelong process and goal. And once I heard that definition, I just sort of breathed a sigh of relief, because the other way, you're always struggling, and you cannot ever know another culture like that culture knows themselves. So, and that ongoing quest. So we are fortunate to have somebody on our board, and her name is Swasti Bhattacharya. And I haven't got an update on that where she'll be here, but she's in India right now. And so when she's around, she was a former BVU professor of religion and ethics, and she lives cultural humility. And so she's an amazing presenter. And I think we've had some really successful workshops in the community, because cultural humility is not just towards other cultures of different ethnicities, but maybe towards the elderly, or maybe it's also, we've had one with the LGBTQ community. So all that becomes very important. Then let's see here. Quickly touch on one more thing that Julie asked me to share, is hunger issues in our community. And man, we have so many wonderful things going on in our community. So what's on our website of SALUD isn't never necessarily things that we generated, but we just want, if people click on here, we want them to be able to see where they can go and how they can access food. And so, having been part of that for a number of years, food distribution in different forms, some of us started to notice that there was one group not being served. And that would be those that actually physically could not get to a pantry, whether it's a mobile food pantry or Upper Des Moines or one of the pantries located in the church. So what about those folks? Again, nod to COVID, because we had time to explore that a little bit. And we, again, we rely heavily on community partners, but chief partner in Friends with Food, which is SALUD and St. Mark Lutheran Church's project, was to ask community members from the hospitals, from Upper Des Moines, from the school, from churches, to see if they could identify people that were homebound, maybe temporarily, maybe permanently. Definitely at that time, there was temporarily homebound people because of COVID. And so we identified them. And so once a month, we get food from the Food Bank of Iowa. We've got a couple of generous grants that allows us to spend about $300 that service between 75 and 80 families every month. And again, that heavily depends on, and we rely upon community volunteers to come and unload the truck on the day of delivery, to pack up the food, and then to deliver the food. And it's mayhem, but it's wonderful and it's beautiful. We absolutely love it. And so the last thing I just want to talk to you about is our direct work with the COVID-19 folks. And we have built a very strong relationship with the health equity team out of the University of Iowa, a collaboration that started pre-COVID and has flourished under COVID. And so one of the things that we did, I don't have a slide up here for it, was I remember how this conversation started. I think it was with some Hy-Vee. They were wanting, I don't know, we were having a conversation with them as some potential partners, and the idea of them wanting to have people come to get the COVID vaccine there. And Amelia Marroquin, who is a force to be reckoned with in Storm Lake, Iowa, and powerful, wonderful voice, spoke up and said, if you want to get those people vaccinated, you have to go to them. And I know that's a hard sell, but that's sort of what we believe, is that instead of always asking people to come to us to hear the great information we have to them, we call them up, say, hey, would you be interested in this? And if you are, where could we do it? At what time, at what place, what is your convenience? It is not efficient, American style, but it is absolutely efficient and essential when it comes to building a relationship that you can grow. And so we did at least, and I am grateful to Hy-Vee because they did it. They sometimes even took their, they have a, what do you call that truck, Julie, their medical facility is on wheels, right? A mobile medical thing. And they actually, this is a great example. We did one for the Laotian folks. We did one for for Latinos, not just Mexican, excuse me, at their time, at their convenience, at their locations. And then we went to the Micronesian group. Well, actually the Pompeian Micronesia group. There's many groups. And interestingly, they have one of the chief leaders in that community lives right across the street from Hy-Vee, has her store across the street from Hy-Vee. And when we went to Hy-Vee, they said they can't walk across the street to come and get their vaccine. And I think it was Swasti that said, have they come across the street to get their vaccine? And the answer was no. So this is amazing of them that they took that truck, because it costs money, brought it across the street. And we had our little vaccination clinic there, which took, that was sort of a harder sell, took some relationship building beforehand, but we strongly believe in that. We also did a series of videos with a local videographer, Ben Gallagher, who was like, what is he? 19. Now okay, he's going, but he was a graduate from the high school in town, and also a neighbor. So he put together these beautiful little videos. And again, these are at least in Spanish and English, but we started with one, and Ben just caught on so quickly. I said, okay, so language is going to be minimal, and the story has to be told in the picture, in the visual. And he's been wonderful about that. So now we are, I think I can stop sharing the screen now. So now we are still in collaboration with the University of Iowa team, of course, with public health, and more exciting things in the future. Certainly dealing with long COVID, this concept of a community health worker, and it's just a very exciting place to be, and a beautiful collaboration. And so again, very thankful to Julie and to Stacey and so many wonderful collaborators in our community. Thanks.
You did great on time, Di. Awesome. All right. So next, another amazing asset. Am I sharing my screen?
Nope, we just see your beautiful face right now, Julie.
All right, hold on here. All right. Now I am? No? Yes?
Yep, you're good now, Julie.
Perfect. All right. So another amazing asset to Storm Lake is Dr. Stacey Cole. Stacey is the superintendent for Storm Lake Community School District. She leads with her heart. Not only did the pandemic throw some curveballs her way, but there are various challenges a community with so much diversity brings each day. Thanks for your time today, Stacey.
Thanks, Julie. So as Di and Julie have been talking, I've been kind of writing some notes about things that I forgot while I was originally creating slides. You're gonna see me kind of look down a few times, but before I begin, I just have to say that I love that we're able to highlight our partnerships today. And Di mentioned it earlier. She mentioned that all of these relationships, the bridge between all of us is trust. And I just want to start there and thank Julie for even inviting us today as a district to be here. I think it's really important that all of this just begins with a true commitment to partnership. So I would make the case that I could ask Julie or Di to do just about anything. And because we are so committed to the mission, and each of us is driven by that cultural humility that Di mentioned before, I really think I kind of live my life with this statement. The answer to how is yes. And I feel like that is what the three of us live by. And I think that's what you're seeing the result from today. And I know for me, especially right now, schools are a little bit of a political punching bag. And so oftentimes we feel very judged by things that happen by people from the outside. And we know that not everything goes perfectly in our school system. Not everything goes well, frankly, many days. But I always know that I've got a no judgment zone at all times with Julie, with Di, and frankly, with pretty much almost anyone that lives in that SALUD universe that meets once a month, because we're all there for the same reasons. And that collective goal is to make Storm Lake the very best place it can be, regardless of who we're trying to serve and how we're trying to do it. And I think that really does help us become what we're talking about today. So Julie, you can go to the next slide. So we've got some challenges and some benefits that come with being in one of the most diverse places in our state. So it was interesting when Julie was going over the stats earlier for Storm Lake and BV County. I have to be honest, I don't look at Storm Lake's stats very much. I look at our school district stats more than anything. And it was really surprising to me. And I'm just going to read a couple of them and then talk to this slide a little bit. So in BV County, 80% of our people in BV County are white. If we trust that the census is completely right, and I know all three of us will say this, but like what we know, right, what's on paper, so 80% of BV County is white. 58% of Storm Lake is white. 14% of my school district is white. So that's just an interesting way to look at, you know, what's real in the census, what are the real challenges, all of those things. That was just really interesting to me. So we have about 33 languages currently spoken in our school district. And so that provides real challenges for us. And so one of the challenges that I've listed here on this slide is that we are rural and we are often without resources. So we often talk about our school district as being a school district with urban challenges, but without the urban resources available in a lot of communities. So we have a lot of challenges with truancy in our school district. Sometimes those truancy challenges go to my top bullet under the challenges. Sometimes it's because the ways of being are very different. We met with a dad this week. He's got has a high school daughter and a 6th grade grandson in our system. And we were meeting with him trying to help his family overcome a challenge this week. And he was sharing with us, he did not make it through 1st grade in his home country and therefore did not get to continue going to school. And so his way of being is different than our way of being. And I love that Di brought in the whole idea of cultural humility, because we constantly remind ourselves in the school district that because something is different doesn't make that way bad and our way good. And that we constantly have to think about that we have multiple lenses in our school district and it doesn't make the dominant lens correct. And we just always think about that as we're helping families deal with their challenges. And so we often do this without resources that are available in some of the larger cities. And because of that, we're better for it, because it has really driven some of those partnerships that we're talking with you about today. Sometimes I'm very great. Sometimes I'm really angry, frankly, that we don't have the resources. Sometimes it makes me really, really frustrated. And these last 2 weeks have been a couple of those weeks. But I do think that not having those resources and having to come together and search out grants together to make things happen does bring us together, and it does help us really formulate that shared vision that we have as a group. So it's not ever like Storm Lake School District doesn't ever seek things out without thinking about how will that impact the work that SALUD's doing? How does that impact the work at BV County Health? Oftentimes, how does that impact the churches in town? Because they're a big part of SALUD and a big part of this mission of being partners as well. And so it's not something that I really thought about before I came to Storm Lake, and frankly, before COVID, was really being strong partners with multiple churches in town. We also, in our school system, have to really balance between supplement and supplant with family needs. So we talk a lot about the invisible ways of being that I just know. I just knew about the invisible ways of being when I came to school as a child, because my own parents were successful in school. They knew the ins and outs of being successful in school. They knew what they needed to do at home to help me be successful at school. So my parents, if I missed class and they found out that I missed class, they helped me think about, and they helped give me some motivation to get to class the next time. That isn't always true for all of our families. And so we're constantly balancing between supplementing the family needs and helping them. And sometimes we admit we go a little bit too far and we supplant and we let our dominant views and our ways of being take over. And that's what we're always trying not to do, but it can get in our way. And that's one of the things that we really rely on our partners is to help us think about at what point are we supplanting versus supplementing needs. Mostly, though, we have benefits from being in this community and being a part of all of these partnerships, and frankly, just getting to be leaders in such an amazing place where we get to learn about the fact that we are not the center of the universe, and there's a whole big world out there, and there's lots of ways of being, and sometimes they're a heck of a lot better than our ways of being, and we get to learn that. And I think because of that, we have very strong trust with families. And so to Di's point with the interpreter workshops, families are trusting us. They're trusting us to do what's right for their kids. They're trusting us to help their kids get ready for the next step in life. And in a time where a lot of places are really experiencing a lot of mistrust, we're really benefiting from, I believe, COVID helped our community mostly come together. We really had to circle around the mission and vision of this community, and it really brought more trust to this community, and I'm really grateful for that. We're talking about community partnerships today, and if you would have asked me before I became a superintendent, what role would the county health department play in you being successful as a school superintendent, I think I would have crossed my eyes at you and thought, what partnership, what are you talking about? The reality is that when COVID struck, we were very fortunate in Storm Lake. BV County Emergency Department, so the police department, emergency management, BV Public Health, Di was on those meetings, churches were in the hospital. We all came together, and on a weekly basis, we talked about what did we need to do for our community. And we took a different approach to COVID, and I'm going to talk about in a minute. But it was the community partnerships that were formed in those weekly meetings that gave me the strength, especially as a female superintendent, to make a really bold move with our COVID response. And so without community partnerships, we would not have responded to COVID the way in which we did. And I really do believe that we avoided some major chaos in our district and in our community because of our response. And Julie can agree or disagree, and later we can talk about that too, right? So it also, the benefits of being here really helps us identify and recognize that we all bring different gifts. So before I lived in Storm Lake, I didn't really recognize that I had a culture. I saw culture as color and race, and it took me a lot of years to recognize that I actually do have a color. It happens to be white. And I do have I have a race that's white, and I have a culture based on who I am and who I've become as a female leader. And all of those things make up who I am. And I have to think about how that influences me every day. That also helps me value the culture of others. That helps me think about different isn't bad. It helps me recognize that when a family tells me that they do things differently than I do in my family, that doesn't make my way good and their way bad. It forces us to think about educating the whole child. We don't have the privilege in this district of only focusing on academics, and I am very grateful for that. I can't imagine, while I want our kids to meet high standards and be ready for that next level with whatever they decide to do with college and career, we will never focus on only academics. We will always focus on the whole child, and the whole child includes that family that trusts us to educate their kid each and every day. So I feel like we're really benefiting from that as a school district. We are truly better informed in this district because we ask questions, we disagree, and we get multiple perspectives. So Julie and I will tell you, like, this, we've had a lot of trouble getting our kids vaccinated. COVID took a toll on, and I'm not even talking COVID vaccine and everybody arguing about whether or not people should get that. I'm talking vaccinations that were here before COVID, and to that invisible curriculum that happens behind the scenes that my family knew all about before I went to school. Our families aren't aware of that. They don't know that they have to do that prior to kids coming into school. And so that's one of the things that Julie has been such a good partner on. And I know she could say, get your act together, but she doesn't say that. She recognizes that we face all kinds of challenges that prevent us from always making sure that everything is done with that. And so they come in and they walk the journey with us. They don't judge our journey. They don't tell us how to do our journey. They walk the journey with us, which is what we try to do with our kids and our families. And then frankly, that makes us better humans because we constantly find the humanity in ourselves and the humanity in others. And that really makes us all better. So you can go to the next slide, Julie. So we had some lessons learned during COVID. Like I said before, we had a different response to COVID in our school district because of those weekly meetings that we were having with local leaders. So you see in this picture, we actually decided that we would put no more than 15 kids in a room, and those kids would be spread 6 feet apart during teaching during the year of 2021. So in this picture, you see a lot of kids are still wearing their mask. We were strong mask wearers in the community and in our schools. When kids were 6 feet apart, they did not have to wear a mask. Our kids got very used to it and it didn't bother them. Amazingly, they were able to breathe. I'm not sure why in other locations you weren't able to, but here we found breathing to be just as easy as before. So we split all of our kids up. That took a lot of work. So we went from classrooms of 25 to 15. We had to add a lot of classrooms. We had to use every available nook and cranny. The kids that you see in this picture, they didn't leave that space during the day. Any teacher that needed to see them came to them. Those kids didn't cross with other kids. We made absolute sure we knew who was in who was in their 6 feet space for 15 minutes and who wasn't each and every day. So we required that kids were wearing masks when they were within 6 feet of each other. And when they were not, as you see in this picture, they were not required to wear a mask. They didn't go to special classes like they did in a normal year. Music came to them, art came to them. They didn't go to library like they normally did. So it really did keep them safe. And I really do believe, we were the hottest county in the country for a while in BV County. And I looked at my moms in this district who brought their families here under really hard circumstances and who trusted us to do what was right by their kids. And I made a promise to myself that I would love their kids like they love their kids and like they deserve to be treated. And so I did a lot of reading about the COVID response in other places. And I read about rich white families plucking public school teachers and putting their kids in pods and educating their kids that way. And I thought, if that's good enough for rich white people across this country, it is good enough for my refugee moms who brought their kids here because they trusted us to help their kids have a better life. So if it's good enough for my kids, it's good enough for my immigrant mamas. And so that's what we did. So because of that, we learned a lot of lessons. And lessons that have stayed is families matter and cultures matter. Who our kids are at home matters to us at school. We don't want to overtake who they are at home. And SALUD and BV County Health and our constant meetings, that helps us remember that all the time. We also learned, because we had to almost double how many classrooms we used. So we had to be very creative about who the humans were in front of our kids and how we utilize teachers. So in some cases, this particular picture is our dual language classroom, so it's a little different. But in our elementary kit classrooms, they spent half a day with a paraprofessional and half a day with a teacher. So the teacher would do all of the instructing, all of the teaching. You have to be a certified teacher to do that. The paraprofessional did all of the reinforcing. So when a para was with the kids, she could, or he, they could read to the kids, they could reinforce lessons that the teacher had done, so they could help them with their math, they could help them with their reading. So the teacher was doing that and the paraprofessional was doing the reinforcement. That actually drove our very large grant that we have today for teacher apprentices. And so we learned a lot of lessons then that we've carried forth today. And we're on track to certify about 50 new teachers in the next 2 to 3 years. And with the teacher crisis, that's a big deal to us. Finally, we learned to listen with love, and that's been huge for us. We really believe that when we respect each other, we meet each other where we are. And that's the example that I gave of Julie and my district with vaccinations. She meets us where we are. We consider interactions from each of our perspectives, and we find that common ground. And we do that as members of SALUD with each other, and we do that in our school district. So Julie, you can switch to the next slide. So I just put some pictures on the last slide that kind of just show who we are. Those top middle 2 pictures, I mean, I think it's important that you know who I am and how biased I am. It is not my story to tell, but in that top to my left picture, you see my family -1 at our bonus daughter, Mary, her graduation. Mary helps me become a better human every day, and I'm very grateful for her and her bio family. To Di's point about cultural humility, I realize every day how brave it was for Mary to move in to my home and to become a part of my family and to help bridge a gap between her family and my family. And I'm super grateful for that. And because of that, that's helped me learn a lot of lessons over time. You see some of my students up in the upper left, helping Julie actually with one of the vaccination clinics. A lesson that we learned bottom left and in the middle was we didn't stop celebrating because COVID hit. We celebrated differently. So you see a family that was sitting together at an event that we held outdoors that would have been held indoors prior to COVID. So you can kind of see the families are sitting separate from each other. The middle is our NHS ceremony. So we didn't stop celebrating NHS. We did NHS differently. We have lots of partners in town. You see that at the bottom right. That is our courtyard, which our teacher there in the middle worked a lot with the city of Storm Lake. We're very grateful for them. That's also a project that happened, even though COVID was hitting. Top middle, you see Julie and her crew at our school doing vaccinations for our staff. That was so helpful to be able to get our staff vaccinated. I cannot thank them enough for coming on site and doing that. And the top right is one of the partnerships that our school district has with SALUD. SALUD does meet and greets with our local legislators every month, starting probably this month, maybe, Di, I'm not even sure, I guess. Usually January, February, March, and our students go and they help lead those, and it's just incredible. And so again, back to the middle, I just thought it was important to show I'm fairly biased. That's who I am as a human. And I think everyone should just know that that's where I come from. And so take it or leave it, right? So I think with that, I think we're at the end, and maybe questions, Julie, is that correct?
Yeah, I think that's all we have. So that is what we have. So I think we have time for questions, if there are any.
Awesome. Thanks, ladies. That was amazing. So I have the pleasure of working from home today, and which means that I also have the pleasure of having my phone in front of me. So I have lots of people that have texted me because they didn't want to put some things in the text. So first of all, lots of kudos in my text messages right now for the energy, the love, the humility, and the use of language that you 3 ladies demonstrated. Knowing the diversity and the backgrounds and the challenges that you all are working with. You know, I had one person text me a metaphor that said I would run through a brick wall for these 3 ladies. So congratulations for exciting the participants. Oftentimes we think about COVID and we think about all the negativity and how overwhelming it was. But you ladies showed that on the other side, through your journey, lots of things. It was like you planted a seed and now you are reaping the benefit of a beautiful garden because your community has worked so well together. So thank you.
Okay, so there were those days like during it. It was rather messy, but now on the other side of it.
You can still make a beautiful cake with mess, Julie. So
Yeah.
I'm just saying it still tastes beautiful. So we need to embrace the messiness too.
Yeah.
So Stacey, you talked specifically about listen with love. That is truly an amazing sentiment and an amazing statement. So one of my friends that's on this call texted me and said, is there a specific tool or mechanism that you use in the morning when you get up, getting ready to work? How do you keep that mindset of listening with love?
I think I always say that as educators, we're better when we've had our own kids, right? So I think that's probably the tool that I use every day, is that I really go to my job and I really think about all of my students. Like, I know we all say that, right? Oh, they're all our kids, right? But like, I have to say, I truly believe that. Like, I truly love our students. And so because of that, I don't really have another way to listen. And so I think it's probably maybe my biggest strength and my Achilles heel all wrapped into one, I have to be honest. Because some days, well, I'll share one day. So one of my daughter's very favorite mentors got COVID at school, and we knew we could trace. I mean, I don't know, but we could trace how he got it, right? So his wife had one of my best friend's daughters in her class, and his wife hugged on that kid every day, and that kid has some challenges that I won't mention today. That wife got COVID from that kid, we're pretty sure. Her husband got COVID from, right? He is absolutely someone that will forever hold a piece of my heart because of his relationship with my daughter. And my superintendent friends will tell you I had to leave work the day that he got very sick and had to be hospitalized because I couldn't hold myself together. And so I think when I say listen with love, what I really mean is really get into conversations and really know who you're serving. Because when you really know them, you can't help but love them. And then when you listen to them, you just don't have, it's like listening to my own, my son or my two girls, right? Like, I always listen to them with love, and that's how I listen to my families too.
Awesome, thank you. And Di, that works in nicely with your cultural humility, correct? You're on mute, hon.
I was thinking as Stacey was speaking of the quote that we have. I'm not going to share a screen. I'm just going to read it to you, but it's a quote from Max Warren, and it's right across from that picture of Stacey's husband, who is the chief of police, who is also a model of cultural humility, has taken on the task of learning Spanish and doing great, but he's kneeling beside two Laotian people at one of the clinics there. But the quote is this: our first task in approaching another people, another culture, another religion is to take off our shoes, for the place we are approaching is holy. Else we may find ourselves treading on people's dreams. More seriously still, we may forget that God was here before our arrival. And my background has led me to be in that place many times, being the other in different countries that I've lived. And you never forget the kindnesses you're shown, the patience that is shown to you by some. You likewise never forget the frustration people have when you're not getting it. Or so I am grateful for those experiences. I'm also grateful, believe it or not, for the times I have made mistakes. And I have a team of people in SALUD in leadership that are loving enough and direct enough to say that what you just said was offensive. And I know you didn't mean it, but, and I've learned how to take that, apologize for it, and move past it. And so it's not all la la woo woo, you know, sometimes it's painful learning. But I am so grateful for that, and grateful that we have that relationship, and not just within SALUD, but in the community. I think we can lovingly come together and say, you know, that I'm thinking that won't work because, or I don't feel comfortable with that because. So again, it slows down a process, but it's so essential to building trust in the community.
Awesome. That's fantastic. We do have a question in the chat, and it's specifically for Stacey. Stacey, Nancy wants to know, how does instruction work with 33 different languages?
So I'm going to answer that. I want to just plug a book, what Di just talked about. If anyone is interested in thinking about what Di just said about being grateful to your partners who will call you out when your impact is different than your intent. And it's called The Person You Mean to Be. And it talks about moving from a believer to a builder. And it's really a great book and thinking about, even though my impact was different than my intent, how do I move on and get better? Instruction with 30 languages, it's challenging. I'm not going to lie. For the most part, our kids are really resilient, and all of our instruction is done in English, other than in our dual language classrooms, which is, it's 80% Spanish, 20% English in our kindergarten rooms where they're really learning, and then 50-50 once they get to first grade and beyond. Otherwise, we mostly teach in English. We play a little bit with some earbuds that do translate. A lot of our languages, though, are not easily translated in this country currently. And so that's like written, all of the things. We do use a communication tool called Talking Points. And so when parents sign up for that, anything we send out does get translated into whatever language they have put in as their main form of communication. It's not perfect. It's a little better than Google if we have to do it. So if I send out a message right now that I just say, send it, it's a little better than Google because it's the education version. If I give them 24 hours notice on something that I send out, an actual person looks it over that speaks the language that it's going to go in. It's not perfect. It's okay. But that does help a little bit. But kids really help kids. We use a lot of strategies. So, you know, Di's been talking about, my husband he's self-taught Spanish, and he helps me a lot think about what do we do in classrooms that help kids that are second language learners, and what did we do in class that hinders that. And so we really just try to use a lot of really quality second language learner strategies in our classrooms.
Awesome. Well, ladies, we have 1 more minute, and I would be remiss if I don't remind everybody in the chat, Brett has put our evaluation, and that really is important to all of us because that also drives, you know, future lunch and learns, and it also gives us an opportunity to give these wonderful 3 ladies some feedback. So Julie, I'm going to give it back to you for any last parting thoughts before I, I want to say thank you. Julie reached out to ask if she could highlight the great work that you're doing in BB. And so I'm really glad that Julie did reach out and agree to my pestering of having you all be on our lunch and learn. So thank you. But Julie, any parting thoughts? You got about 30 seconds.
That's okay. I don't have any. I just want to thank Di and Stacey for their partnership and their willingness to be here today and share what we do. You know, sometimes you just think it's just your normal work that you do every day and you just hunker down and do it, but we do great things. So sometimes it's nice to remember that. So stay warm, scoop snow, all that good stuff. Have a great Thursday.
Awesome. Brett, any parting things we need to know?
Not really. Fill out the eval if you would, please. Otherwise, it is 1 o'clock, so I'll just say thank you, Julie, Di, Stacey, everyone who came and spent your lunchtime with us today. We appreciate you joining us. We hope you can again next month. It'll be on February 16th, I believe. We'll be joined by Brad Anderson and Connie Eastman, who help us get to know AARP Iowa. But otherwise, I think that's all I have. Thanks for coming, spending lunchtime with us today. Have a good one.
Thanks again, ladies.
Thank you.